I used both aspects of my training. So studying dance, I went on to become a Radio City Rockette at Radio City Music Hall. And then I went back to medical school and really pursued what I need to do for the rest of my life to help serve my community. I see all patients, men and women, but I do specialize in women's cardiovascular disease, and I'm the medical director of cardio-obstetrics at Hillcrest Hospital. So I have a special interest in cardiac complications that happen and predisposing risk factors that happen in pregnancy that may portend some outcomes later on in life for women with heart disease. And so I really love focusing on high blood pressure, cholesterol, diabetes, and how we can manage through lifestyle, if at all possible. But we having to realize that we do have to rely on medical resources as well to sort of really reduce outcomes for women in general. I'm always wanting to meet patients where they are. You know, everyone comes from a different background and a different journey in life. So really understanding where people are coming from initially always helps set the stage. So when people come to see me, I usually start by just introducing myself and trying to find some little tidbit of connection with them. We're just trying to have a conversation with people and get to know them. And these are intimate things they're telling me about their health, and I want them to feel comfortable with that. I think the most rewarding part of my job is really seeing people reach their goals. And so at least once a year, I try to ask the patient, what is your overall healthcare goal? And for me, that might be something different than what the patient actually perceives themselves. So it's important to really have that established. And just to see patients that come back and say, you know, I feel better, I was able to lose weight, or I'm now exercising regularly, running around with the grandkids, that is really fulfilling when they can really implement that change for themselves.